Good morning. You know, I'm always saying we're passionate about posture around here. And this morning we're talking about why we shrink as we age. Do we need to shrink as we get older? But you always see grandma and even perhaps your parents starting to get shorter, or the doctor says, oh, by the way, you're a half inch shorter than you were last at your last exam. Why is that? Well, I'm glad you asked because I'm going to tell you. Do you see this spine? Each spine segment is divided by one of these little things called discs. Everybody's heard about a herniated disc. But there's 24 of these shock absorbers going up and down your spine. They're 90% water, people. 90%. So what happens as we age, if we don't move these segments, if we don't do exercises, if we don't move, those discs that are 90% water start to dehydrate. And what happens if each one of those dehydrates just 1/8 of an inch? Correct. We start to shrink. What happens when we start to shrink? Here's a good question. Do we change our posture first and then the discs shrink, or do the discs shrink and then we change our posture? So how many of us have seen, especially an older lady, walking around like this and walking like this? In that case, there could be two causes, but the cause that we're going to talk about is the disc space has shrunk in her middle back, and this causes a hyperkyphosis or a hyperbending forward. So that's the problem. What do you do about it? What do chiropractors do about it? Joints that move lubricate. Joints that move keep healthy. Joints that move don't desiccate or lose their hydration at the speed that a joint that's not moving loses its water. Final answer: movement, movement, movement. Do it yourself or come to the chiropractor, and we will assist you in moving joints that feel stuck, or if you're bending forward too much, we will address your posture issues. But either way, motion is the lotion. Move, move, move. Okay? Thank you, and we hope you enjoyed that lesson today.